Hello, social workers. I'm Brett Peterson, one of the instructors for this course, and I wanted to take a second and talk to you about case conceptualization and introduce this concept. Sometimes it's called case formulation. This is important because one of our major assignments in this course is doing a case conceptualization and a treatment plan. So I want to kind of focus on just what is a case conceptualization in case you're not familiar with that. So to begin this discussion, I want to kind of go through the logical progression of working with a client. So the first thing we do, of course, when we work with a client is to do an assessment. We meet with them, then we do an intake, we gather a bunch of information. And in a very broad sense, an assessment is gathering data. Now I'm going to use my clinical judgment and the information that I'm learning in my MSW program to determine when I need to probe a little deeper. So if a client says I'm really hopeless, I feel like there's just no point anymore, then I'm going to assess further for suicide. So we use our clinical skills and we gather data. That's the assessment. Then usually the next piece that we talk about is kind of going into the treatment planning stage with clients. And a good treatment plan is something that we ideally do and with the client, and we work together to kind of establish those goals and those objectives. Now, in between gathering the data and the treatment plan, there's a lot of information that's like, how do I make sense of this to determine what is kind of going to be that best course of action? And the case conceptualization or the case formulation is your chance as a clinician to step back and say, what do I think is going on here? Now, as a beginning clinician, when I worked at a community mental health, I had a really good supervisor who really had me do case conceptualization. It was not part of the formal things that we had to do with the client as far as what the insurance required. But this clinician who was really wise said, hey, I want you to, these first 10 cases, I want you to do a case conceptualization. Gave me a form similar to the one we're providing with you. And it was helpful. And it really helped me think about the client and really gave me that space to kind of go from assessment to really considering the client and then moving on to treatment plan. So it's really important. I don't always do a case conceptualization now, but when I have a difficult case or there's a lot going on and I'm just like, I don't know what to do or where to start with this client, that's my signal, hey, step back and do a case conceptualization. And I'll actually get out the form and I'll do it, and it's incredibly helpful. So with case conceptualization, a lot of times you can link the case conceptualization to the actual treatment modality that you're going to do. So if you were studying ACT, acceptance and commitment therapy, there are some case conceptualizations that kind of walk you through doing that treatment with that client and the questions that you'd want to consider in developing a treatment plan as ACT as your treatment modality. We're going to kind of use a CBT case conceptualization, where in our case conceptualization, what we're going to do is we're going to consider the client's automatic thoughts, the things that they have told us, and then a lot of times clients don't say, well, this is my automatic thoughts. But it will be our chance during that case conceptualization to hypothesize, what are some of these automatic thoughts that I think are coming up with a client in these different situations. We'll also be able to kind of hypothesize what we think are the schemas or these core beliefs that might be driving the automatic thoughts, that might be driving kind of the anxiety or that presenting problem. So case conceptualization really allows us to step back and to think. And we're allowed to, in the case conceptualizations, to kind of hypothesize. We want to make sure we're hypothesizing on the data, not necessarily on our own biases or beliefs. And we want to make sure when we make a hypothesis, hey, this is what I think is going on, that we're holding it loosely. That we're not saying, this is for sure what's happening, but we're kind of saying, based on what I know now, this is kind of where I think it's going, and this is kind of the direction we should go for now, unless something comes up and I want to reassess and kind of move in a different direction. So it just really allows us to hypothesize and to think and to really understand the client. Oftentimes in case conceptualization, we really get to put in that strengths. You know, what are the strengths in the environment? What are the strengths that the client has? What are those resources? So it really helps prepare us and prepare our mind state, so as we go in to working with the client, we have and developing that treatment plan, we have really thought about the case. Okay, so our next step, now that we've kind of generally talked about case conceptualization, the best way to learn is to do. So what I want you to do is, after this video, is go ahead and click on the link to read the case study for Michelle. So go ahead and read that case study, and then I've completed a case conceptualization form, the exact form that you're going to be using for the assignment, on Michelle. So go ahead and read the case study, and then download and read my case conceptualization, and then watch the next video. In the next video, I'm going to go kind of step by step on the case study of Michelle and why I put things in different areas and kind of what I was thinking. So I'm going to actually do a case conceptualization for you with that case study. So then you'll be able to do it along with me, practice along with me, and then that will prepare you as you do the assignment for this week. So good luck, and I'll see you in just a few minutes after you read the case study of Michelle and you look at the case conceptualization form. Take care.